Hello. So we start with a new topic in the central nervous system, and that is the anti-epileptic drugs. Now, this is a very important topic as far as the central nervous system is concerned. And anti-epileptic drugs are important because epilepsy has become pretty common, and so a medical student ought to know about all the anti-epileptic drugs. So whether they are the older ones, the new ones, the cheaper ones, the expensive ones, and everything. So that's why they are so important for examination, whether it's a university examination or your entrance examination, any kind of that examination. Anti-epileptics become a very important part of your examination. Now, before I actually go into the drugs, we'll be doing some general terminologies, and we'll be doing the types of epilepsies, and then we'll be doing what is the pathophysiology. Only then it's going to be more clear to you what actually epilepsy is all about, and then how can you target those different pathophysiological features. Right, so let's get started now. So before I go into the types of epilepsies, so first let's see, there are two terminologies. Sometimes they are interchanged, used interchangeably, but actually they're not the same. Okay? So sometimes people use seizure, sometimes people use the word like epilepsy, and usko epilepsy hai, usko seizure hai. So हर एक seizure epileptic seizure नहीं होता. So every seizure is not an epileptic seizure. So because seizure, what is happening there is that there are neurons which are firing, continuously, and they are overexcited. So neurons are firing continuously. They are firing in a synchronized manner, and that's leading to the hyperactivity of the neurons, right? So that is a seizure. So seizure basically is neurons discharging in group of neurons discharging in highly synchronized manner. Okay? So one is getting, let's say this means that one is getting excited, it passes excitability to the other neuron, and so on and so forth. There is continuously passage of these high electropotentials. So they're all discharging, and they're getting fired at the same time. So that's a seizure. Now, seizure is not every time an epileptic seizure, because you've heard of a terminology called as febrile seizures, where seizures occur because of high grade fever, and this is true for children in about around up to 5 years of age, when they have very high grade fever. So they can develop febrile seizures, जिसके लिए हम diazepam देते हैं by the rectal route. Then seizures can be because of certain drugs. It can be because of certain you can say conditions like hypoglycemia and all those conditions. So a single episode, if it occurs because of some thing, we don't classify as an epilepsy. Jab seizure starts occurring repeatedly, then we call it as an epilepsy. So over a period of time, when seizure occurs repeatedly, then we label it as an epilepsy. A single episode of seizure will not label it as epilepsy. So what is epilepsy now? Seizure to हमें पता लग गया, but what is epilepsy? When there are a group of neurons, and so there are a group of neurons discharging, in a highly synchronized manner. And what is happening, they have episodes of seizures. So group of neurons having so kabhi ho raha hai, it is not ki subah se sham tak it is happening. So it is happening when there are certain episodes, maybe an episode a day, 2 episodes in a day, 3 episodes in a day, or maybe 3 episodes in a week. So episodes of seizures are occurring, and it can be, there can be disturbance in the consciousness of the person. So person can either have loss or no loss or disturbance in the consciousness. Okay? So loss ho sakta hai, no loss or disturbance in the consciousness of the person. And then there can be movements of the muscles or the motor body movements होते हैं, जिनको हम कहते हैं convulsions. So convulsions, again, it can be present or it may not be present. So they can be there. Then there can be certain other features like sensory or psychiatric, all those features, depending on the type of area involved and the type of epilepsy. So sensory or the psychiatric phenomena. So देखो epilepsy में there are so many things. So there is a group of neurons, right? एक neuron भी there usually a focus होता है, एक group of neurons हैं, they're firing, or there is an episode of seizure. So seizure में क्या होएगा? Neurons are discharging synchronously, ठीक है? And so there is seizure. Then there can be loss of consciousness. There can be simply disturbed consciousness. Patient doesn't know he is conscious, but जैसे उसको पता नहीं है कि where is he present, what is happening to him. So that's disturbance in the consciousness. He cannot, identify with the time, place, and person. Or there is simply no loss of consciousness at all. कुछ भी नहीं है. Then there can be those characteristic body movements. It is seen in certain types of epilepsies, and it may not be seen in certain types of epilepsy. So it can be present, it cannot be present. Then there are certain other phenomena, कईयों को sensory phenomena है, psychiatric phenomena है, because it all depends on what area of your brain is involved. ठीक है, वो जो सीजर का फोकस है, जो सीजर जहां से ग्रुप ऑफ जो न्यूरॉन्स हैं वो कहाँ पे इफेक्ट हुए हैं, ठीक है. So it's a combination of so many things. Epilepsy, it is just not seizure है तो बस epilepsy हो गया. No, it's a combination of so many things, and these can be unpredictable. A person cannot predict कि कब होने वाला है, ठीक है. So now this is, let's say, in the brain, these are so many areas involved. So we have the frontal lobe, we have the temporal lobe, the parietal lobe, the occipital lobe. Now each of these lobes, they have very important areas within them. For example, the motor speech area of Broca in the frontal lobe. Even there are motor areas that are present here. ठीक है. Then temporal lobe में auditory areas हैं. Occipital lobe में visual area है. Parietal lobe में then sensory speech, vernix area जो है, that is present here. So अगर focus इधर है, ठीक है, it's beginning in the frontal lobe and it is involving the frontal lobe. So there can be speech defects. Speech में problem आ सकती है patient के, ठीक है. Motor area involved है, so obviously यहाँ पे motor convulsions आ सकते हैं. अगर defect यहाँ पे है in the temporal lobe, तो there can be auditory hallucinations हो सकते हैं patient को. So that kind of presentations is there. Occipital area है, so visual hallucinations हो सकते हैं with spreading. Sensory speech again speech defects हैं. Even frontal lobe में behavioral areas होते हैं, तो patient को behavioral issues भी आते हैं. So the presentations may differ in different types of epilepsies depending upon what area is involved. And most often, this temporal lobe area is involved. Usually temporal lobe area is very commonly involved, and तो जो area involved होएगा तो लोगों को auditory hallucinations बड़े common होते हैं. So before the actual attack, because then this can spread to the, definitely जब एक focus है, it will spread to the other areas and then it will involve so many sign symptoms. But to start with, let's say the temporal focus begin हुआ, तो इन पेशेंट्स में दे बिफोर एक्चुअली अटैक, जैसे कन्वल्जन से पहले उनको ऑडिटरी हेलुसिनेशंस होने शुरू हो जाते हैं. दे स्टार्ट हियरिंग थिंग्स व्हिच एक्चुअली इज नॉट देयर. So they'll start hearing things, and that tells them that now they're going to have an attack of the epilepsy. And then as the epilepsy progresses to different areas, it will involve the other areas and other important areas, and therefore the signs and symptoms appear. So this is about the epilepsy. It is not just a seizure. There are so many things, symptoms together, they form an epilepsy. Okay? So this is about the epilepsy. Now here I was trying to tell you that how the neurons are firing, how epilepsies are occurring. So these are two neurons, if I tell you, and this is how one neuron speaks to the other neuron. So one neuron will speak to the other neuron by the help of the neurotransmitter. So यहाँ पे इनके receptors होंगे and it acts on the neurotransmitter of the other neuron. So it can either stimulate or it can inhibit the other neuron. So अगर stimulate करेगा तो within the neuron कैसे message pass होता है? By the help of the action potential. Action potential आया, sodium ions are involved, calcium ions are involved, and they trigger the release of the neurotransmitter. It will go in the synapse, go to the other neuron, and if it is stimulating the other neuron, again यहाँ पे action potential होएगा, ठीक है? Again there is entry of sodium here and the calcium here. and the further उसका neurotransmitter आगे जाएगा. So this is how your impulse or your signal is transmitting from one neuron to the other. So talking within the neuron, it occurs with the help of the action potential, and talking between the neurons, it occurs via the neurotransmitter. So this is how your signals are passed from one neuron to the other. So epilepsy में क्या होएगा? Mainly trigger action potential over firing हो रही है. So action potential है ज़्यादा, तो आपके जो main channels हैं वो है sodium and calcium. So if you are able to inhibit these channels, you can decrease this overactivity of the neuron. So you can manage the epilepsy. So most of the drugs which we have today, they will either block the sodium channels or they will block the calcium channels. Apart, we have some other drugs also, but these two remain the main channels of focus. Okay, now we come to what are the various types of epilepsy that we know about. The types of epilepsy are either we can have a generalized, जहाँ पे seizures, ठीक है, generalized type है, या partial seizures या partial epilepsy, ठीक है, हम कह सकते हैं. तो यहाँ पे अगर हम बात करेंगे what is generalized and what is partial, so these are like to the cerebral hemispheres. So in generalized, what happens, the focus, it begins here, it begins here also. So it is spreading. So it is, it is both the hemispheres are involved, not only one hemisphere. So both the hemispheres are involved, and therefore there is it's called a generalized epilepsy. While in partial epilepsy, usually the focus is in one hemisphere. एक area में begin होता है. Gradually ये एक lobe involve करता है. But अगर it extends, then it can definitely, अगर treat नहीं होता for some other reason, it can progress to the other hemisphere also. But the focus usually primarily it is just the one hemisphere. That's why it's a partial seizure or epilepsy in generalized. So generalized usually can be of more grave in nature. And the common ones we have are the generalized tonic, clonic seizure. This is one very common type of epilepsy. The whole body, generalized है, there is tonic. Tonic means एकदम stiff हो जाते हैं. Body becomes very stiff, muscles become stiff. And clonus is like convulsions. So there is generalized tonic, clonic seizure. So it is like this. You can see the patient having generalized tonic, clonic seizures. The second type of generalized are the absent seizures. So in absent seizures, what happens is that the patient is absent from the environment for few seconds. So if, let's say, I'm talking to you and I have an absent seizures, I'll be just like, and then suddenly everything is okay. So for those seconds, I didn't know what happened to me. Okay? So if you try to ask me, "Aapko kya hua tha?" I wouldn't know. So there is no contact with the surrounding. It is not actually loss of consciousness, but there is impairment of consciousness in this kind of. In generalized, because generalized mein usually there is loss or impairment. Partial mein there may not be any loss of consciousness. Okay? So in generalized tonic-clonic seizure, there is loss of consciousness. Absent seizures mein mostly we say it is impaired consciousness. So it happens in children, and there can be so many episodes in a day, and it gets reported. Either the parents will notice or the teacher will notice कि बच्चा काम करते करते he just gets lost and he doesn't know what happened to him. So then that comes into the knowledge of the parents. So these are absent seizures. Third is atonic seizures. So atonic seizures means muscle has no tone. So when the patient is walking, suddenly he loses the muscle tone and he will fall because muscles become relaxed and flabby. So that's atonic seizures. Then we have the myoclonic seizures. So what happens in the myoclonic seizure, that means the muscles are having the clonus, myoclonus. So clonus हो रही है muscles में, and so there can be muscles जिस area के involved हो रहे हैं, whatever area is involved generalized. So there is just those seizures of that particular area. It's myoclonic. Muscles are in the clonic. There's no tonic phase here, only the clonic phase is here. It's called as myoclonic seizures. Now, partial seizures, they can be simple partial seizures. So in this, definitely the patient has a seizure, but there is no loss of consciousness. Patient is usually most of the times is aware of what is happening to him. So there's no loss of consciousness. It's called a simple partial. Then we have the complex partial, where the patient doesn't know what's happening to him. There's no loss of consciousness, but there is impairment of consciousness. So he doesn't know what's happening to him. He cannot figure out what's happening to him during that period. And the third one is that if this further progresses, it can lead into secondary generalized seizures. That they are not primary generalized. वो पहले से नहीं है. They were partial to begin with, but eventually they, because involved the other hemisphere, so they became secondary generalized seizures. So it's very difficult to distinguish clinically. अगर present कर रहा है patient, we cannot distinguish it's a primary generalized or secondary generalized. So where on EEGs or the scans and all, then you can make out, because then you see that it was actually the focus was here and then it spread to the other side. As I told you, temporal lobe epilepsies are more common, and the partial seizures usually can be because of some focus, it can be due to some cancers. It can be even the the neurocysticercosis that can trigger the seizures, epileptic seizures. Any lesions, okay, in the brain can trigger that partial epilepsy. Mostly it is because of some or any of these things, or injury, or that area which is injured, that can also lead to this. So these are the types of epilepsies, and we have various drugs which can act on these epilepsies. So apart from this, these are epileptic seizures. Or agar generalized tonic clonic epilepsy, it is occurring in episodes, then that's fine, But what happens in sometimes in patients where there is so much severity in such cases, the episodes can occur one after the other without any regaining in the या बीच में free period नहीं है. जैसे patient को normally attacks हुआ generalized tonic clonic seizure, so he has an attack and maybe after 30 minutes the attack is over. He may have a second attack maybe in the same day but later, or in the second day or the third day, or maybe after a week, but there is a recovery period in between the two attacks. But when there is no recovery period, so one attack is occurring, then the second attack is occurring, then the third attack is occurring without any recovery period in between, so that becomes very serious. So, and that condition is called as status epilepticus. And this is an emergency condition where the attack is occurring one after the other without any recovery. So patient is not regaining consciousness in between. So there can be, it's an emergency. There can be respiratory arrest. The patient can have damage to the brains because the neurons are repetitive firing. There is one after the other. So this becomes an emergency to treat with. So when we do the drugs for the epilepsies, we'll be also discussing specially how to treat status epilepticus, because it's an emergency, needs to be treated in the emergency. So you have to give drugs which are by the parenteral route. बाकी epilepsies के लिए orally drugs दे सकते हैं, but emergency के time पे for status epilepticus we cannot give the drug by oral route. Obviously patient is not conscious, you can't give anything orally, you have to give things by the parenteral route. So these are about the general points in epilepsy, and what we'll do in the next lecture would be the pathophysiology, because when the pathophysiology is clear to you, I'll be taking that pathophysiology up in the form of a diagram. It will become very clear and easy to you, and we'll be introducing ourselves to the drugs also, though I'll be dealing with drugs in details in the subsequent lectures, but उसी diagram में हम कुछ drugs के mechanisms भी कर सकते हैं, and it will become very easy for you, believe me, to remember. So अभी हमने just the general points किए हैं, that what is seizure, what is epilepsy, the difference between them. Every seizure is not epilepsy. Epilepsy is like a syndrome with so many things together, and it depends what kind of area in the brain is involved, which leads to those kinds of signs and symptoms. And I told you that from one neuron to the other, how the signal, how they talk, हम बात करते हैं, वो कैसे बात करते हैं आपस में? They talk by releasing neurotransmitters. ठीक है? So they talk by releasing transmitters, और अब within the neuron बात कैसे होती है? वो ऐसे होती है by action potential. ठीक है, so action potential के थ्रू बात होती है. So this is how it happens. Then the types of epilepsies: generalized and partial epilepsy. Generalized means the whole, both the hemispheres are involved. Partial means a single hemisphere is involved. And generalized में most of the times there is loss of consciousness or at least impaired consciousness. Partial में it is either there is no loss or there can be impairment of consciousness. But there is कभी ऐसा usually कम होता है कि there is complete loss of consciousness until and unless the patient enters into the secondary generalized. And then we talked about serious condition, the status epilepticus, which means it's an emergency condition where the seizures, they are not stopping, they are coming one after the other without any stopgap in between, and the patient is going to land into respiratory failure. Patient can land into damage to the brain, to the neurons, because that area is hyperexcitable and it can lead to brain damage in the patient. That's not good for the patient, right? So yeah, so next time in the next lecture I'll be discussing the pathophysiology, and we'll be highlighting the drugs which act on the various points or various parts of, you can say, the mechanism, how the epilepsy, on those various mechanisms, how the drugs act. Right? Okay, see you then. Till then, take care. Bye-bye.